Okay, we are good to go.
Okay, well, thank you. Well, thank you, everyone, for joining yet again another quarterly webinar from NV Medical. I am Cindy Duncan, and with me is Dr. Felipe Jimenez. Thank you, Dr. Jimenez, for joining us again.
Thank you, Cindy. I truly appreciate your participation. I know that you're out in the middle of an airport somewhere on the East Coast, so I really appreciate you being able to join us today.
Well, thank you. It was a little problematic this morning on the first call. So if anyone that's on this call is coming in for round two, thank you for muscling through with that this morning. So what we're going to talk about with this webinar is all about SilkPeel Body. It's summertime. I know I'm in the Northeast. It's awfully humid, so I know that people are definitely wearing shorts and sundresses and going to the beach. So we really are looking at a lot more area of skin than we do when we're in the winter months. So what a great time to introduce and reintroduce to everyone the SilkPeel Body, because these are two hand pieces that are completely unique in our area of dermal infusion, and it really gives you so many more offerings for your patient population to be able to treat hyperpigmentation, signs of aging, dryness, acne on every area of the body where you have skin. We can treat you with the SilkPeel Body. Everyone is very familiar with the SilkPeel device, so we're not changing the device of any sort. We're just going to be using two different hand pieces. So it works very similarly with the SilkPeel face procedures, where the majority of the procedures will be going from medial to lateral, and you'll let the machine do the work. It will guide you through the SilkPeel Body treatments, and we continue to use all of the solutions that we have for the SilkPeel face. So you can see on this slide just a quick review of how we are completely unique in the marketplace, and now we're completely unique in the marketplace for body as well as face. So we're evacuating the pores, we're removing the stratum corneum, we are infusing skin-specific solutions all the way down to the dermal epidermal junction. So we really are getting full saturation, and the results on body is just as impressive as it is on the face. These are what the body hand pieces look like. You can see they're quite large, and we'll be showing you several videos in a little while to show you live procedures. So it enables you to get through a large back, chest, abdomen, arms, and legs in a nice, quick manner, and it's very very relaxing and soothing to the patients, as well as very comfortable. I love this slide, and Felipe, I'm going to have you jump in and talk about this slide a little bit. It's one of my favorite punch biopsies. It's so powerful.
Yeah, absolutely. So Cindy just talked a little bit about dermal infusion, really how it sets SilkPeel apart, but really what does it do? What does it translate to? So basically, in the about two slides ago, we looked at the fact that dermal infusion really does three different things. So really, with the use of vacuum, what it does is it brings the skin up into the actual handpiece, and it brings the skin in contact with the diamond tip. And then as the operator glides that handpiece across the skin, obviously you're going to go ahead and exfoliate away that stratum corneum, but at the same time, using pneumatic pressure, you're really infusing that solution into the skin. So basically what that translates to, when we look at this punch biopsy slide, is really two things that are very, very visible here on this punch biopsy. Now, before I explain that, let me just explain what you're looking at here. So this is a single punch biopsy whereby the right-hand side of that biopsy has been treated with SilkPeel. The left-hand side has not been treated with SilkPeel. So two things that you really notice on the side that was treated with SilkPeel. Number one, you're missing the stratum corneum, or that dead layer of skin. And number two, that darker pink area, the epidermis, is swollen, and it also contains these little white bubbles that actually represent the solution that's actually been driven into the skin. Now, if you look at the left-hand side, it still has the stratum corneum. You see that part of that epidermis at the top has started to swell, and you also start to see some of those little bubbles there. So the reason why the area or the site of the punch biopsy that was not treated with SilkPeel also has some of those bubbles there is because that's what we call the leading edge, okay? So when we're actually forcing that solution into the skin via pneumatic pressure, it's doing it with such force that you actually get some of that solution even into the part of the skin that has not yet been treated with the SilkPeel. Okay, so that's just, shows you that the power of the SilkPeel and certainly the power of, dermal infusion and that pneumatic pressure for really driving those solutions deep into skin.
So you can be just very proud, that you're representing SilkPeel with all of the patented technology, not only in the machine but also in the hand pieces. And then we have, proprietary blends of formulations with the Lumixyl solution and the Clarity MD, as well as an awesome option for hydrating and vitamin C. So all of these solutions can be used with the body just like they can with the face. So Felipe, can you kind of review what you recommend when you're talking about different skin conditions on the body and what solutions really should we be picking?
Yeah, for sure. I mean, I think that this slide is just as important as the last slide before it, just because this also is what sets SilkPeel apart from every other device out there on the market today. Just the fact that you can tailor the SilkPeel treatment to different skin conditions, totally sets it apart from other machines like traditional microdermabrasion that is kind of a one-trick pony in that all it does is it removes the stratum corneum, or some of the other devices on the market today that only use kind of a one-size-fits-all solution that they use for every patient without regard of whatever indication that they're treating. So in this case, with SilkPeel, we do have 4 different solutions that allow us to treat a variety of different indications. So, for instance, for the skin hydrating solution, you can treat dry skin and eczema. For the vitamin C solution, you can definitely target photo damage, fine lines, and wrinkles. With Lumixyl, obviously, you can target hyperpigmentation. And with Clarity MD, you can definitely look at treating things like acne, rough skin, or even keratosis pilaris, for instance, on the back of the arms as well.
Now, when we're talking about stretch marks, like stretch marks on the abdomen, I got a lot of questions on that, on the glute area, and also on the breast. What solution do we pick and why?
Yeah, absolutely. When you're talking about stretch marks or even scars on the body, you definitely want to be able to remodel the skin first. And the best way to remodel it is by using certainly something that would have an acid in it, like our Clarity MD solution. But then you want to build up that skin again, right? You want to build up, normal tissue where that scar tissue was or that stretch mark tissue was. So you want to follow that up with something like a vitamin C solution that will definitely help to build that collagen and certainly build healthy new tissue around that area as well.
So what you're recommending then for scars or stretch marks would be to start with Clarity MD, and then would you go back and forth, like do one treatment of Clarity MD and then one vitamin C? Would you do any Lumixyl in that combination?
Yeah, I mean, you can definitely alternate them. I think the first probably 2 treatments or so you probably want to do with Clarity MD, only because you want to be able to remodel that scar tissue or that stretch mark tissue first. And then you want to go ahead and follow it up with another 2 treatments with vitamin C as well to build up that brand new healthy tissue there. And then if you have, those stretch marks or those scars, that certainly are hyperpigmented or that have PIH on them, you certainly want to then follow up with the Lumixyl solution as well thereafter. Okay,
great. That was so helpful. So we all love the Lumixyl solution, and we talked a little bit about application. So anywhere that someone has, PIH, regardless of where it is. I also have been asked out in the field There are patients that when they get laser treatments, they do get PIH, especially around the bikini line. Would you then do Lumixil, with a SilkPeel body, like maybe the 15 millimeter to treat that?
Yeah, absolutely. I think one of the other areas as well is, so for instance, people that get tummy tucks, some women, especially women, of Hispanic heritage, or women of darker skin types, will tend to get that PIH, especially around the incisional wound site. So definitely, I think one of the things that some of our plastic surgeons, are doing that have SilkPeel is what they do is they pre-treat the area first, so that they can avoid some of that PIH from, setting in, and then after the incision actually epithelializes and closes up, what they do is they'll go ahead and use SilkPeel to treat that area for two reasons. Number one, to be able to resolve, that scar tissue, and make it look more like normal surrounding tissue, but at the same time also to prevent any PIH from setting in thereafter as well.
So when you're doing it pre and post surgery, what level of exfoliation? What would you use? The 100 grit? Would you do the 00? Would you do an 80?
Yeah. So basically, before the actual surgery, you could probably want to do like 100 grit. After the surgery, once you have that scar tissue there forming, you've got wound cosmesis, you probably want to back off a little bit just because the skin is still healing, and you probably want to go down, to using like maybe a 140 grit or something like that would be fine, or even 100 grit, just depending on the sensitivity of the skin, the thickness of the skin as well. Obviously when you have people with Fitzpatrick type, 3 and above skin, they can probably handle, even the 100 grit, after their surgery would be fine. Those patients that have, lower, lighter Fitzpatrick skin types, you probably want to do like a 120 or 140 on them.
We also had someone that was inquiring, her underarm area with all the shaving is very, very dark and has a lot of PIH. Would you recommend doing the SilkPeel, body on that as well with the Lumixil?
Yeah, I would definitely do it. I'd probably use a 15 millimeter head on there. Since the underarm area is a little bit more sensitive, you definitely want to use a lighter grit. You probably don't want to use like a 60 grit or an 80 grit. So anything like maybe a 120, I think would be appropriate for that area.
Okay, great. And let's talk a little bit more, because I know that this is the solution of choice with the salicylic acid that we're using when we're trying to do, scar revision and also stretch marks.
Yeah, absolutely. So the reason that we want to use the Clarity MD is because obviously it does contain the salicylic acid. Now, we did have a question that came through a little earlier asking whether our new Clarity MD Pro Infusion solution was the same as our old clarifying solution. And the answer is no, it is not the same, only because not only does this particular formula contain the salicylic acid, but it also contains our proprietary PCX technology that also incorporates, a retinoid-like botanical ingredient that is an antimicrobial for fighting acne as well. But it also has some great anti-aging properties with it as well, so it will definitely help to, remodel some of that scar tissue and skin as well.
Great, so it'll probably do even a better job than using the old formulation of the salicylic.
I agree.
Yeah. And then tell me a little bit when we're going to, let's say, so we've done the breaking down, and now we want to build up around that area that had the scar tissue or the stretch marks. Is that why we're then going to the vitamin C?
Yeah, absolutely. A lot of people, when they hear, about vitamin C products, I think the first thing that comes into their mind is the fact that vitamin C is a great antioxidant. But, we really forget the fact that vitamin C is absolutely necessary for building collagen. So, when we're treating a scar, when we're treating a stretch mark, you definitely want to be able to follow that up with a vitamin C, a hydrating solution treatment, only because this solution will definitely help to build or rebuild that healthy tissue there in place of that scar, in place of that stretch mark. So you definitely want to make sure that you incorporate this vitamin C solution into any treatment that you use, for treating scars, whether they're new scars or old scars, or whether you're treating stretch marks as well.
Okay. And then this is, everybody's favorite, hyaluronic acid, and it's fantastic for all body parts. And I would just say mostly, I would say probably on legs and chest and back area that's just super dehydrated from really lack of attention. The people, they spend all this money and attention on their face, and then their neck gets a little bit, and then their chest gets absolutely none, and their arms and hands don't, and their legs need a lot of help. So it's wonderful to, when you have those VIP patients that come in, all the time, get all the treatments, their face looks amazing. Now we can treat the rest of the body to catch up to what they've done for anti-aging for their face and neck.
Absolutely. I think, one of the other areas that gets overlooked as well is the feet. And especially for those of us who have, for those of us that have those dry, cracked heels, I mean, this is a godsend solution, really. The hydrating can really make a huge difference there as well.
Yeah. So, Felipe, I'm on 11 of 11. So do we load another half of a program for slide?
We are on slide 11. I'll go ahead and switch it to slide number 12 here. We're looking now at SilkPeel body indications. As we talked about before, the SilkPeel doesn't only treat the face or the neck, but we can also treat a lot of different body indications as well. Again, we talked about treating the neck and décolletage, whether it's photo damage or hyperpigmentation. For the back, shoulders, and the chest, again, you can treat those areas, especially the back, for younger patients that do have that back acne. Looking at upper arms, you can definitely treat things like keratosis pilaris there, dry skin. For the lower décolletage and breasts, I mean, especially the breasts, after pregnancy, or even after breast augmentation surgery, some women tend to get stretch marks in those areas, and we can certainly use SilkPeel body to help with that as well. Looking at the lower abdomen, obviously after pregnancy, you can definitely treat the stretch marks on the abdomen as well. The bikini line or other hair removal areas, for sure, if you've got those razor bumps there, or folliculitis, acne, we can definitely treat that with SilkPeel body. It's super important, the knees and elbows and feet, especially the knees and the elbows for sure. Those areas tend to have very thick stratum corneum, and they tend to be darker areas. So you can definitely use the SilkPeel body to treat those areas and certainly get rid of, some of that hyperpigmentation there as well. And certainly you can treat other areas on the skin too. Cindy, it looks like we've got a little bit of background there where you're at.
You know what? So I'm going to let you continue, Felipe, and I'm going to go ahead and put myself on mute. If I can fix myself. I must be at the
All right. No problem. I think I can go ahead and do it.
Yeah, if you mute me, that'd be great. I'll let you keep going since my slides are not paying attention to me. So,
okay.
Okay.
All right. Sounds good. Thank you.
Thank you. Okay.
All right. You know what? I'm not able to mute you because you're on as a presenter as well. Let me see if I can. Okay, there we go. I think that worked. Okay, so perfect. So, we talked a little bit about, some of the competitive advantages of SilkPeel before. And I just want to reiterate, again, these competitive advantages include the fact that SilkPeel really is a crystal-free procedure, so you're not really using those aluminum oxide crystals anymore. And so, you don't have to worry about crystals getting embedded into the skin, and certainly don't have to worry about getting in, these crystals into the eye area or anything like that. So for that reason, we definitely have an advantage over traditional microdermabrasion. Best of all, again, this is a patented technology. Dermal infusion is patented, so there are no other devices on the market today that have dermal infusion. Again, we can treat multiple conditions. SilkPeel is not a one-trick pony like traditional microdermabrasion or some of the other devices on the market today. We can treat multiple indications like acne, like dyschromias, or even tinea pedis on the feet as well. Best of all, SilkPeel is operator independent. Keep in mind that when you're doing a SilkPeel procedure, you don't need to push down on that handpiece whatsoever to create exfoliation. All you need to do is simply attach it or create vacuum between the handpiece and the patient's skin and simply glide that over the skin. You don't need to press down on it, and you get even abrasion every time. So again, just to reiterate, with SilkPeel you can definitely get even skin resurfacing every time. Again, the SilkPeel procedure is not operator independent. Again, this is all possible, because of that dermal infusion that we talked about before, because of that pneumatic vacuum that brings the skin in contact with that diamond handpiece. And again, because of that, all you need to do is simply glide that handpiece over the skin. And again, you're going to get even skin resurfacing every time. We talked a little bit about using SilkPeel body to treat stretch marks on the breast, as you can see here, with 3 SilkPeel treatments performed once per week over 3 weeks using the Clarity MD and Lumixal solution. Again, we're able to see some just huge differences here in those stretch marks for sure. Again, these stretch marks appear to be hyperpigmented at baseline, and certainly the Lumixal solution was even able to get rid of some of that pigmentation there as well. The Clarity MD just did a fantastic job of remodeling that tissue for sure, so that it doesn't appear that those stretch marks are there after just 3 weeks. I apologize for that 2 weeks being on that after photo, but it actually should say 3 weeks there. Moving on to looking at treating solar lentigos on the chest, hyperpigmentation. You can see here that after 8 weeks, after just 5 SilkPeel treatments, done once every 2 weeks, with the Lumixal solution, you can definitely see huge difference there in this patient's solar lentigos, certainly on the chest area. So again, just speaks volumes, as to, how efficacious the SilkPeel body treatment is for, other body parts other than the face as well. We talked a little bit about abdominal stretch marks. It looks like she's got some stretch marks there. She also has some dimpling there around the abdomen, and after 4 SilkPeel treatments, again performed once per week using both Clarity MD and Lumixal, after 4 weeks, you're able to see a pretty big difference there, not only in the stretch marks but also the dimpling there on the patient's skin. We talked a little bit about feet as well. A lot of people neglect their feet, especially those dry, cracked heels. You can see here that after just 4 SilkPeel treatments done over 7 weeks, with Clarity MD and hydrating solutions, you can see a huge difference there. Keep in mind that we're using the Clarity MD to, basically exfoliate away that really thick, cracked stratum corneum there on the patient's heel, and then we're going to go ahead and use that hydrating solution to go ahead and get rid of the dry skin, make sure that their heels don't crack again. So it's really a treatment and a prevention all in one, and using Clarity MD as well as a hydrating solution as well. So now let's get into the fun part of it. So how do we actually perform a SilkPeel body protocol for, let's say, the back? Well, we've got these written procedures that we've got here on these slides, but we also have these very cool videos that Cindy so graciously did for us. And she actually shows you how to perform these procedures as well. So the last time we did this earlier this morning with the webinar attendees, I actually went through each of the written protocols, but that takes a little bit of time. And Right now, we're actually running a little bit behind just because we have 6 different videos to show you. So what I'll do is I'll just go ahead and talk a little bit about what vacuum we're going to be using, the flow, and then what side we actually perform procedure. And here we go.
SilkPeel body protocol for back, and we will be using the 25mm hand piece, even for a patient that is as petite as Dawn. There again, like the 15mm, there is a toggle switch that enables you to lower the diamond head to get more depth of vacuum, which also will increase circulation, distribute subcutaneous fat. But for Dawn, we're going to leave it all the way up so that you get most infusion and exfoliation. And again, you want to tip all the way up to the top when you're doing back acne as well. You can see that we're going to turn the flow down to between 20 and 25, and that is about half of the flow as you do with the 15mm tip, because the tip is so much larger, it pulls more solution, therefore the flow is going to come down. We're going to have the vacuum between a 3.5 and 4.5, and right now that's at a 3.5, and we'll see how that feels with Dawn, and after we check in with her. How does that? Is that too much suction?
No, not at all. Feels great.
Okay. So I can feel, as the operator, I'm not pushing, but I'm moving the wand down. I'm going to move this flow up a little bit to a 2.5. So you'll see that we also will have some drippage, just like we did with the 15mm. But when you keep the flow a little bit lower, it won't be as wet, and you'll still get the great exfoliation and infusion. So Dawn, we're at a 3.6 vacuum, and that still is comfortable for you.
Yes, very.
Okay. So I want everyone to see when I occlude the tip, you see how the skin is coming to the diamond tip, and you can really see it in these larger hand pieces. And any extra solution I would just rub in. And slowly go up to the nape of her neck. So you'll be doing 2 passes again, just like you would with any other SilkPeel treatment. And if you're doing more acne, you would then do a lot of spot treating. And we have some great protocols for after acne. So you can see the hand piece is a teeny bit drippy, but as it drips solution in, you're going to just smooth that in to the body. And if you wanted to continue this over the shoulder and add a little bit on arm, you could. So it just kind of depends.
All right, perfect. So that's how we do the back treatment. So moving on to the chest and décolletage area. For these areas, you definitely want to set the vacuum to a PSI range of about 4 to 6. You want to make sure your flow is at about a 50% The reason why we're going up in flow is because now we're going to be using a different SilkPeel body handpiece. This time we're going to be using the 15 millimeter handpiece, so it's a little bit smaller than the 25 millimeter. And again, you definitely want to go ahead and set it to the most shallow setting to be able to treat this area. Our SilkPeel body chest video, and here we go.
And we're going to be talking about the SilkPeel body today. The first area that we're going to treat is the chest area, the décolleté, and we like to use the 15 millimeter handpiece. As you can see, this is a little bit smaller than the larger 25 millimeter handpiece that we use for back and larger body areas. I want you to see how this handpiece has 3 levels of height. So you've got the closest to the tip is going to be for general exfoliation and infusion, very similar to our face handpieces. Then when you dial it down 1, then you have a little bit more lymphatic drainage and also muscle stimulation. And then when you dial it all the way down, then you have the most lymphatic drainage and also moving the subcutaneous fat. So you have choices on these handpieces. So with the 15 millimeter, you have 3 choices, and then on the 25 millimeter, you have 2, which we'll talk about in a little bit. So I'm going to dial this back up since we're doing Dawn's chest all the way to the top. And you can see when I check my vacuum, I want it to be between a 3 and a 4. So I'm going to start it at a 3 with Dawn and check it with her and see if she's okay. So we're going to go from medial to lateral, and we start at the top of the neck, or the chest rather. And Dawn, for section, how does that feel?
It feels fine.
Okay, so since it feels fine, I'm going to move her up to a 3.5. So basically what we're doing, these hand pieces enable you to get through 4 ounces of solution in a decent amount of time. If you're doing this with a 6 millimeter or a 9 millimeter, obviously you have a lot more passes. And you can see the body hand piece has a little bit more solution. So if you have any solution, is that okay?
Yeah.
Okay. There's no pain? Okay. So you can see it's a little bit more suctiony, and it's a little bit, you have to manhandle the body hand pieces a little bit more. But what we still want to go out from medial to lateral, because we're still doing the lymphatic drainage. And anytime you see any of the solution, you're just going to rub that in to continue to help the solution go into the skin. But as you see, just with this one quick pass, how her skin is more hydrated, and she's got a teeny bit of erythema. So you're going to go medial to lateral, and then you're going to start that on the other side. And it's just very similar to the face, where we're also going to be doing 2 passes, and then kind of spot treat wherever you want. We really like vitamin C for sun damage, and also the Lumixil for, kind of more intense sun damage and hyperpigmentation. So this is a great segue into when they're doing their silk peels for their facials, talk about the ability to have an add-on for an arm, for sun damage, chest, décolleté, and then we'll also be doing some other body parts today. And you see Dawn's got a little bit more of a collarbone.
All right, perfect. So that's how we do the SilkPeel body on the chest area as well. Moving on to the abdomen. For the abdomen, we definitely want to use a vacuum PSI range of between 3.5 and 5.5. And the flow, you want to go ahead and use a flow of 50%. Again, you want to continue to use the SilkPeel Body 15 millimeter handpiece. You definitely want to set it to the most shallow setting as well. And with that, let's go ahead and look at them as well.
So we're going to be doing Dawn's abdomen with the SilkPeel Body system. And we want the handpiece to be on the tallest portion, so we're getting the most exfoliation and infusion. In all of these treatments, we are working with the lymph system. So this is at a 3.5, Dawn, and is that too much suction for you?
No, not at all.
Okay. So we're at a 3.5 and a 50 flow. And we always start medial to lateral. And we have little towels rolled up here to grab excess solution. And if there's any excess solution, I like to rub it into the skin whenever I'm doing the body treatment. And if you zoom in right here, you really can see dry skin, not dry skin. So that's just one pass. And when we finish that second pass, then we've really infused and exfoliated where she's going to have a really, really nice result and be very happy. So we're continuing to go in nice, easy strokes, very similar to the face. And if you pop up, it's fine. You just start where you left off. Dawn has a nice taut belly with muscle tissue. So sometimes the hand piece wants to kind of pop off, but that's okay. And Dawn, even though we're at a 3.5, are you okay?
Mm-hmm. Yeah, it still feels light.
Okay.
Just very comfortable.
Okay. And then all the way down to the top of her hips. And we'll be repeating that on this side and do 2 passes just like you do with the face. I wanted to also show you the abdominal has a complex lymphatic system. So when you do around the belly button, you want to go clockwise. Okay. So Dawn, for example, you know, a lot of people will go to a spa and get a massage and get, you know, a sugar or salt scrub for hydration and exfoliation. Tell me, you know, how does this differ?
This feels amazing, like a massage, but like with the scrub is messy.
Mm-hmm.
And
All right, perfect. So that's how we use SilkPeel to treat the abdominal area as well. Moving on to the next slide. This is the SilkPeel protocol for treating the arms. In this case, you definitely want to set the vacuum to PSI range of between 3 and 4. You want to make sure that you set your flow at about 50%. Again, you're going to be using the SilkPeel Body 15 millimeter handpiece, again, set to the most shallow setting. With that, let's treating the arms as well.
So we're going to be talking about doing the body SilkPeel treatment on the arms. We're going to be using the 15 millimeter handpiece. We want the toggle switch to be all the way to the top. So it's got 3 depths. It's got a deep, medium, and shallow. And so we want a shallow depth because we're doing mostly just exfoliation and infusion. So it's very similar to the settings of the chest body system. So the vacuum is from 3.5 to 4.0. So I'm going to have Dawn's vacuum at a 3.5 to start, and then the flow is at a 50. So I'm checking my vacuum, and we're just going to, again, glide down just like we do with the face, and check in with our patient. So Dawn, how does that feel?
It feels very comfortable.
Okay, so she's at a 3.5, and this one we're just using hyaluronic acid for her arms. And when they're on there, now if it gets a little bit more sensitive on the inside, Dawn, please let me know.
Okay.
Is it still okay?
Yeah, it's still.
So you're still doing passes that you're sort of, layering the passes, just making sure that you cover all of the skin. You can start up here more on the shoulder and bring it down. And you can see there's a little bit more solution with the body hand pieces as opposed to the face. So when you're doing your passes, you just want to make sure that you are rubbing the solution in. See how Dawn's having a little bit of erythema? That's normal. And then I'm just going to bring her arm out here. And so if she had KP and I was using the Clarity MD solution, that's a tough skin condition. So this vacuum would be quite a bit higher. So she even may get welting, scratching, not bruising, but just definitely some results from the higher vacuum. So make sure that your patient is dialed into that and ready to have some swelling or scratching if you are working on something like KP. So Dawn, how does that feel?
It feels good.
Okay. So what you want to do is kind of go around the elbow like we're going to do on the knees, sort of in a circular fashion, to make sure that you get nice and saturation on that skin, because it is very dry. People like to get their elbows done with the arm. So we just do nice, long strokes to infuse and exfoliate. And Dawn, you're still feeling pretty good?
Yeah, very.
Okay. So as the operator, you can kind of position them where you feel most comfortable. You just want to make sure that you're going to get the entire arm if you're going to do an arm treatment. And then you can also add in the hands. You could, a good one would be, I think a good combination would be the décolleté and arms.
All right, excellent. So that's how we do the arms with the SilkPeel body. I think that the elbow area is again one of those areas that really gets neglected. And so with the SilkPeel body, again, you're able to just strip away that really thick stratum corneum there that seems to be more hyperpigmented than the surrounding tissue, and you can really give people softer elbows, that have a skin tone that's more like the surrounding normal skin around it as well. Moving on to the legs. This is kind of a bigger, larger protocol, just because the leg area there's so many facets to it. So it's definitely a longer protocol. With the legs, you definitely want to make sure that you set the vacuum to PSI range of between 3.0 and 4.5. You want to make sure that the flow is set at 50%. Also, you want to use the SilkPeel body 15 millimeter handpiece. And I guess this really depends on just the size of the legs that are treating. Obviously, more petite patients. Obviously, you can get away with using a 15 millimeter handpiece. For those people like men, larger men, they're going to have bigger legs, so you can definitely think about using a 25 millimeter handpiece on them as well. In either case, you definitely want to make sure that either handpiece is set at the most shallow setting. With that said, let's go ahead and turn to a longer video here, so bear with me.
So we're going to be doing the body for all 4 legs, and you have 2 choices. You can either use the 15 millimeter, which I have with me now, or the 25 millimeter, depending on how large the patient is. Dawn here is very petite, so I'm going to be using the 15 millimeter. I wanted to remind everybody that there are 3 levels of depth with this handpiece. You have the most shallow, which is going to do your basic infusion and exfoliation. As you get lower, you're going to have more muscle stimulation, more increased circulation. You're going to, then on the deepest level, you're going to enhance the redistribution of subcutaneous fat. So we're going to put this all the way back to the top, and we're going to start on Dawn's lower leg and work towards the knee, and then do a circular motion around the knee, and then go towards her bikini line. We like to start between a 2 and 3 psi and a 50 flow, which we have done for the neck and the arms. After you do your first pass, you ask your, can I go a little higher?
Yeah.
Okay. So if that feels good to her, let's go ahead and go up to maybe a 3.5. And we'll see how that feels for her. Is that okay?
Mm-hmm. Yeah.
Okay.
Still feels good.
Okay. And you can see that this treatment is a little bit more wet than your face treatments. So you want to stretch the skin as you come up towards the knee. This is really great, pre-laser hair removal. Can help with reducing the little bumps that they get after. So if you want to stack those sort of treatments, that would be awesome. And just for overall hydration of the skin, you would use hydrating solution. If you're looking for more sun damage, you would use the vitamin C. If they had acne, on their legs, you would then use the Clarity MD. So you can see that it's just slow passes up, and we're at a 3.5 vacuum, and we're at a 50 flow, which is enabling us to really get the saturation and exfoliation we want without having too much leakage. And even on Dawn, with the shin area, you're going to have to be a little bit more finessey because you want to get on the side of that shin bone so that you still have the occlusion. And again, you can see how the skin is literally being sucked up into the handpiece. If Jen wants to come in close, you can see where I put the handpiece down, and the skin is coming to the diamond tip, even close to the shin. And then now we're going to go up towards the bikini line. And if this gets too uncomfortable, Dawn, please let me know, and I can always turn down the vacuum.
Okay.
How is that feeling?
Still feels good.
Okay. As I am the operator, I'm just gliding the handpiece on the skin. I'm not pressing. So you're going to have 3 different positions. You're going to have this butterfly position. Then we're going to be doing the straight leg position. And see how you have a little extra solution? You're just going to rub that in. If you wanted to put a roll towel here and here on the side, that would work as well. So depending on how you have your bed set up, you definitely are going to need more towels with the silk peel body. So now I'm just going to have you move your leg straight. So we do, now that we've done sort of the inside of the leg, now we're going to be doing the same. So really, as the handpiece comes up and you have more solution, that's when you just would like to sort of rub it in. And where you get to the bony point, just sort of like on the nose, when we do the exfoliation infusion of the silk peel on the face, we want to go on the side of that bridge of the nose. So you're going to do that on the leg as well. And then you're going to go around the knee, like we did with the elbow, because now the tissue is pretty fleshy. And then we're going to move up. And Dawn, how does that feel? You're at a 3.5 vacuum and a 50 flow. Is that okay?
Still feels, yeah, still feels soft.
So this is where, you know, with this sort of amount of leg, you could do the 25 millimeter up here, you know, if you wanted to, for time. So make sure that you're stretching the skin back with one hand, and as you're going forward with the other body. So now, we're going to have her roll.
Excellent. So that's the protocol for doing SilkPeel body legs as well. So moving on, let's look at the last video. This is the SilkPeel body feet. In this case, you want to make sure that the vacuum PSI range is set to between 8 and 9.5, so that's a lot higher. And the reason that we need to have it that high is just because the stratum corneum on the feet, especially the heels, is super thick. So you want to be able to get enough vacuum there to be able to pull it up and in contact with that diamond tip. And then you want to make sure that the flow is set to 100% as well. Again, just because the skin is so thick in that area, you definitely need to have more, certainly lubrication, but also infusion into the skin as well. In this case, you also want to use the SilkPeel body 15 millimeter handpiece as well, set to the most shallow setting. And now body system.
So we're going to show the the SilkPeel body protocol, and I'm going to be using a 15 millimeter hand piece, and we're going to start working on Dawn's heels and the bottom of her feet. We have the flow at 100%. We have her vacuum at a 9.2. And Dawn, how does that feel?
It feels good.
Does it?
Yeah, it just feels, I mean, there's like a little pressure, but it's comfortable, like a massage. Because it just feels like a foot massage.
Does it?
Yeah, it feels good.
And I can, you know, I have to manhandle it a little bit, but it's not impossible. You can see her heels compared to her heel that's untreated. This is with one pass. So this is really doing quite a bit, even with the very first treatment. And Dawn, again, tell me if this is comfortable.
Yeah, very.
Like, that really looks so much better. So you can see the difference in heel, really both of the feet, as I'm just starting with my first pass. And then if you wanted to maybe even have...
All right, perfect. So as you can see here in this video, definitely turning up that vacuum and certainly using the SilkPeel Body 50 millimeter handpiece there, it just works wonders for the heels and the feet. Just a very quick result there after just one treatment. So that's different protocols that we have for SilkPeel Body so far. So moving on to other aspects of SilkPeel. Definitely most of you have probably already seen this, the SilkPeel potential annual revenue slide. And again, just by doing, 4 procedures per day, obviously after, different costs, cost of goods and tech time and whatnot, you can definitely net out $137,000, almost $138,000 in net revenue per year. But you can definitely help increase this simply by taking advantage of our different monthly specials for sure. Today we have a webinar promotion for you. So if you buy 4 cases of any Pro Infusion solution, you will definitely receive 1 free case of Pro Infusion of your choosing, plus 12 free sunscreens as well. So again, make sure that you contact your ND Medical sales person and make sure that you take advantage of these promotions as well. Moving forward, these are different ideas for sell-through as well, and I'll go ahead and bring in Cindy so she can present these to you.
Hi, can you hear me okay?
I can hear you.
Okay, great. So, so these are just some things you can do for a SilkPeel Body event. And right now is a perfect time since it's so hot and everybody is probably looking at little parts of their body they would like to get looking better. So you could even talk about how to prepare for spray tans, get glowing skin for weddings and summer get-togethers, have a foot facial night, and then also really address things like back acne, KP, things that are really bothering women that they don't really realize they have a real alternative to be able to fix those conditions. So just a few things to think about. You could do a SilkPeel face treatment, buy one, get a body treatment free, or you could just do a full body SilkPeel event where you buy one body part and get a second body part free. And I would recommend giving away the Moisture Lock sunscreens that we're giving you. So for the first 12 people that attend and sign up for your SilkPeel event, they get a free Moisture Lock sunscreen, which is so fabulous because it's completely chemical free and has that awesome ingredient, that's Helios 1031, that's going to prevent DNA damage from even happening. So those are just a few ideas that you could even do for this summer, since we haven't even gotten into July yet. So you could do a SilkPeel event, Summer Sexy Skin, either in July or August.
Yeah, absolutely. And obviously to help bring more patients to your office and certainly bring more awareness of SilkPeel to your patients here in the United States, we're certainly doing a lot of marketing initiatives, whether in print or in television for SilkPeel. So in the past, you may have seen SilkPeel being featured in different programs like The Doctors, like Entertainment Tonight, ABC News, the E! Channel, on Extra, on Windy City Live over in Chicago, on CBS News or Fox News. So, stay tuned because we are definitely going to continue that, and we definitely are going to continue certainly raising more awareness of the SilkPeel as well with patients. Don't forget, we also have SilkPeel marketing collateral as well. We've got our pocket reference guide that you see there at the bottom left. That definitely tells you how to set up the machine for a procedure, how to perform the procedure, and then how to shut down the machine thereafter and clean it as well. We also have some brochures there for your patients that tell them about SilkPeel, what it is, what it does, and what benefits they will derive from it. On the far bottom right, you'll see that we have our before and after flip book there for Clarity MD, for SilkPeel, as well as our Lumexo Topical Brightening System. And as a matter of fact, for attending this webinar, we will be sending you a free copy of this before and after picture flip book that you can then receive with your next order as well. And with that, I just wanted to thank you all again for joining us today for today's webinar on SilkPeel Body. I really appreciate it. Cindy, thank you so much for participating as well. I know that you're out there in the middle of the airport right now, but thank you so much for joining, and I truly appreciate all your help. And again, if you have any questions at this time, you can go ahead and enter those in the in-meeting chat box. Simply find the icon on your screen that looks kind of like a bubble or a balloon. Go ahead and click on that. Then go ahead and write your questions there, and we'll go ahead and get to them as we receive them. So with that, let's go ahead and look at our first question. This one comes to us from Michael Mayer. The question is the Clarity MD solution the same as the salicylic acid solution? So this is our prior clarifying solution that we had before, and the answer is no. The clarifying solution that we had before only had salicylic acid. In the case of Clarity MD, not only does it contain the salicylic acid, but it also has our proprietary PCX technology that contains a botanical antimicrobial that has the same potency at killing the acne bacteria as that of clindamycin. So we definitely added that to it as well. But this same ingredient also has some retinoid-like effects as well that will definitely help give you a great anti-aging benefit as well to skin. We have another question from Michael Mayer. The question is, what are you recommending for pricing for body treatments? Cindy, do you have a feel for what people are charging out there for different body parts?
They mimic what they're charging for face. And then when they do promotions, they'll do like buy a SilkPeel face and get body at half price. Things like that. You can combine. It kind of depends on what body part. In a lot of the facilities, when they're charging like a full price SilkPeel price, they're using the whole 4-ounce bottle of solution, and they may do a couple parts. It's more like time with the esthetician, the half-hour appointment, and kind of what they can get done within that appointment and how much solution they use. So there's a couple different ways to price it out.
Yeah, absolutely. And again, it definitely has to do with certainly the surface area of the body that's being treated. Obviously, if you're doing a back or the legs, there are going to be some technicians that, may take a little bit longer to treat these areas. You may actually use more than one bottle of solution for these, and obviously you're going to have to charge a little bit more, for these areas, just because of the surface area that's being treated. For sure, I think that the national average, I think, for face treatment is going to be about $175 for the treatment itself. So, that will give you kind of a point of reference there, for pricing out other body parts as well, especially, larger body parts like the back or even the legs as well.
Yeah.
Okay.
But if you have smaller body parts and you can get through several in a half an hour, I would charge the patient, just kind of time in the room and how much solution. Because a lot of times you'll do a SilkPeel, back on a more petite girl, and you'll only get through maybe a half of a bottle, and will go pretty quick. So you just kind of have to play with it, see how your estheticians are doing it on patients, and just kind of go that way is what I would recommend.
Absolutely, absolutely. So we've got one other question. The question is, can I have copies of the protocol to share with my other estheticians? For sure. We will definitely make these available to you. We'll certainly make sure that everybody gets a copy of the link to the recording of this particular webinar, and you'll be able to see the protocols there. You'll also have access to the different videos that we presented here as well. So we'll make sure and send those out. If not today, by tomorrow morning, you should have that as well. I also want to let everybody know that we will also be uploading copies of all of the videos that we had here onto our SilkPeel.com website as well. And we'll make sure and send links to you on that. I believe this site is going to be password protected, so we'll make sure and send you the password for you to access these videos as well. It looks like we don't have any other questions at the moment. Again, if you have any other questions, feel free to reach out to our customer service department or certainly your NV Medical salesperson. You can always reach out to Cindy Duncan as well, my co-host here. And as a matter of fact, I believe we have her contact information on the last slide here. So once we get you the link to this presentation, to the recording of this webinar, you'll be able to get her contact